You've probably heard a lot about coronavirus testing recently. The following is information about the types and stages of coronary diagnostic tests. Apart from intelligent algorithms such as the online corona test, which can assess the state of infection through the onset of coronary symptoms, there are two types of COVID-19 tests for more accurate corona detection: infectious detection test or PCR and antibody test. The first case, the PCR test detects the presence of any current infection in the body. The second case, the antibody test, shows whether you have been infected in the past. Subscribe our YouTube channel to watch the rest of this video and more. In the PCR test, a sample is taken from the respiratory system, such as putting an air cleaner in the nose, to determine if you are currently infected with the virus that causes COVID-19 disease. Some tests are performed at the patient care facility, which the test result is ready in less than an hour at the same test site, but another batch of tests needs to be sent to the laboratory for testing. It takes up to 2 days. Let's talk about how to do PCR test. Here is some information to help you decide on an infectious disease test. Most people get a mild illness and recover at home without the need for medical care. If you have symptoms of COVID-19 and have not been tested, be sure to stay home. At present, no definitive treatment has been approved for COVID-19 patients. What we do after infection detection test. If the test is positive and you are sick or caring for a specific person, take precautions. If the test is negative, you probably did not get the disease at the time of the test, but that does not mean you will not get sick. The test result means that you did not have COVID-19 at the time of the test. If the test samples is taken in the earliest stages of the disease, the test result may be negative and later during the disease. You may also be exposed to COVID-19 after the test and then become infected. This means that you are still likely to spread the virus. If you develop symptoms later, you may need to have another test to determine if you have the virus that causes COVID-19. Now how about antibody tests? In this test, antibodies are tested on a blood sample to determine if you have ever been infected with the COVID-19 virus. An antibody is a protein that helps fight infection and protects the body against reinfection with the virus, or immunity. This test may not detect the body's current infection because the body begins to produce antibodies 1 to 3 weeks after the infection occurs. If the answer is yes, a positive result indicates that you may have antibodies in the body due to the COVID-19 virus. However, a positive result may mean that you have antibodies in your body due to a virus from the coronavirus family, such as the virus that causes the common cold. The presence of viral antibodies that cause COVID-19 disease may protect against recurrence. In this case, we still do not know how much antibody protection or how long it provides immunity. You still need to take care of yourself and others against the virus, as you may get the virus again. If you have a job that requires you to use personal protective equipment, continue to use it. Your antibody test may be positive even if you have never had symptoms of COVID-19. If you get sick without any symptoms, this condition is called an asymptomatic infection. And if the answer is no, you may not have had COVID-19 before. You may be infected at the moment, but it does not show up in the test. The reason the test is negative is that it takes 1 to 3 weeks for the body to produce antibodies. If you have recently been exposed to the virus, you may still be infected. That means you are a carrier of the virus. Antibodies take longer to make in some people, and some people who get the virus never make antibodies. Regardless of whether the test is positive or negative, the results do not confirm whether you are a carrier or not. Take action to protect yourself and others until more information is available to us.